Assalamualaikum warahmatullahi wabarakatuh. My name is Safitri Hilda. Today I will presentation the research about the effectiveness of the application of self-hypnosis and prenatal gentle yoga on gravidarum and emesis in the first trimester pregnant woman. Emesis gravidarum is inconvenience that often occurs in the first trimester of pregnancy. Continuous emission of gravidarum can be bad for the health of pregnant women, and the fetus being convinced, so it must be overcome as early as possible. One of which can use non-pharmacological therapy, namely applying self-hypnosis and prenatal gentle yoga to reduce emission of gravidarum can make pregnant women relax. The purpose of this study was to analyze the application of self-hypnosis with prenatal gentle yoga on emission of gravidarum in the first trimester pregnant woman. The research method. For the type research, the design of this study used a quasi-experimental design with a two-group pretest post-test design without control using purposive sampling. For the sample, this research was conducted on the first trimester pregnant woman who experienced emission of gravidarum in the PMB Dani Sidoarjo of 32 pregnant women in the first trimester. For the data, self-hypnosis was carried out of every day for approximately 15 until 30 minutes for 1 week, while prenatal yoga was carried out 3 times a week for 30 minutes. Data collection on the intensity of nausea and vomiting used the PUQE questionnaire. For the analysis, the process of the data analysis using independent t-tests to analyze the application of self-hypnosis with prenatal gentle yoga on emission of gravidarum. This graphic I will explain. For in the first graph, it can be seen that respondents who experienced nausea and vomiting before being given self-hypnosis treatment, almost all of them, or 93.7%, were in the moderate category, and after being given self-hypnosis treatment, almost all of them were in the category of not vomiting, or 87.5%. In the second graphic, while in the second graph show that almost all of the respondents who experienced nausea and vomiting before doing prenatal gentle yoga, or 87.5%, were in the moderate category, and after doing prenatal gentle yoga, most, or 62.5%, were in the mild category. So, the result of data analysis between the variable of self-hypnosis and prenatal gentle yoga show that the p-value is smaller than 0.05, which means that the application of self-hypnosis and prenatal gentle yoga affect in emesis gravidarum. In addition, there is a mean difference between the self-hypnosis and postprenatal gentle yoga, where the mean difference in the self-hypnosis treatment group is greater, that is 1.77, while in the postprenatal gentle yoga, the mean difference is 1.25, and show a greater decrease in intensity. Nausea and vomiting in the self-hypnosis group, which means that self-hypnosis is more effective in reducing the intensity of nausea and vomiting in emesis gravidarum than prenatal gentle yoga. So based on the result of this study, can be concluded that first therapy of self-hypnosis and prenatal gentle yoga can significantly reduce the intensity of nausea and vomiting in pregnant women in the first trimester. Second, self-hypnosis is more effective in reducing the intensity of nausea and vomiting in emesis gravidarum than the prenatal gentle yoga. Third, therapy self-hypnosis and prenatal gentle yoga can be used as a non-pharmacological therapy that is safe, effective, and can be done a lot at home and has minimal side effect. So that's all about the presentation for this research. Thank you for the attention. Wassalamualaikum warahmatullahi wabarakatuh.